Hello everyone, I'm Dr. Angela Mattke and you're watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. I'm a pediatrician at Mayo Clinic Children's Center. Twice per month, I host a show about pediatric health topics where we take and answer your questions live. Today, we're talking about influenza and what you need to know to keep your family healthy this season. Joining us for this discussion is pediatrician and immunization expert Dr. Robert Jacobson. Dr. Jacobson has held many leadership roles, including the past president of the American Academy of Pediatrics and is the medical director of Mayo Clinic's Employee and Community Health and Southeastern Minnesota Region Immunization Program. Dr. Jacobson is a professor of pediatrics at Mayo Clinic and has led many research studies on vaccine safety and effectiveness. We are honored he can join us here today. If you want to join in the discussion, please send your questions under the Facebook Live video feed, and we'll try our best to review them during the live video broadcast today. Dr. Jacobson, thank you so much for joining us today.
Oh, I'm delighted to be here.
It's an honor to have somebody who spent so much of your career dedicating to the safety and protecting the health of children through immunizations. So thanks for joining us.
Oh, I'm glad to be here.
Okay, so let's start by talking about when does the flu season typically start to occur? Are we already in it or is it coming?
You know, we typically start seeing an uptick in cases as early as December. It might peak in December or it might not peak until February. Then the cases start slowing down. We might see a second or third peak in March or April. We can still see outbreaks in May and even June, and recent studies show that actually the flu never really goes away and cases keep cropping up every month year-round. But I like to think of December through March as a time where we really want to be doing our best to prevent the flu. But I tell patients, even who are not vaccinated in April or May, get your vaccine. It's still worth it.
Absolutely. Why is it so hard to kind of predict when the flu virus is going to come in and cause kind of more illness amongst people?
These waves of viruses are traveling by person to person around the globe. And as people get infected and become then immune to it, the virus actually starts mutating and evolving so that by the next winter, we're actually seeing something that has been crossing the planet, changing and evolving so it can attack humans. That makes it unpredictable. That means it's dependent on infectivity and past resistance and current immunity. So it becomes very problematic. And this virus seems to do best in infecting us during cold weather. Maybe it helps with transmission, maybe it helps with contagion and severity, but it seems to like the cold. In fact, one of the early names the flu had was an Italian name, Influenza del Freddo, which meant under the influence of cold weather.
Okay. That makes sense. Absolutely. Well, in Minnesota, we have our fair share of cold weather, and that's coming. So is the influenza virus coming. So what should people be looking for the symptoms of influenza?
Well, I think we have a graphic that we can show our viewers. Influenza often shows up as a sudden onset of a fever of 100.4 degrees or higher. If you're measuring that in centigrade or Celsius, that's 38 degrees or higher. Now, for children less than 12 months, the only obvious symptom of their illness would be the fever. In fact, older people, 65 years and older, may not mount a fever and yet be fairly sick with the flu. Most of us, though, will have a sudden onset of a fever with this illness. Now, classically, the flu is a respiratory illness with a cough, with difficulty breathing, and with wheezing. The flu can also cause, and often does, cause a headache. If you're old enough to be able to say you have a headache,
Right.
You can imagine being 1 or 2 years old with a fever. Your parents will see that you're irritable, fussy, you don't feel like doing things, and that might very well be the headache. Also, muscle aches are common, as are feeling washed out, fatigued, with no energy. Now, children, more often than adults, will also have what we call gastrointestinal symptoms like nausea and vomiting and diarrhea. Anybody of any age with the flu is at risk for becoming dehydrated because we tend to underdrink and we're using more fluids in our body with that fever. we might actually suffer more with the cold weather in terms of hypothermia. And children less than 12 months of age are really at risk to get chilled and can even become unresponsive with the flu.
So the flu symptoms are often confused with other illnesses. A lot of times people will say, oh, I had the flu, and what they really had was some type of GI virus, like with vomiting and diarrhea. Can you talk a little bit about that, and then we'll talk more about other illnesses?
Yeah, I think we've always been sloppy about using the word flu. Part of that is our fault. In the doctor's offices, we won't spend your money on testing for the flu for the most part. We test when we're going to hospitalize you. We test when it's a very serious situation for your particular health. But most cases of the flu go undiagnosed. Right. So then you start hearing this sloppy use of the word flu. We'll talk about people having the stomach flu, or about having the flu when in fact we know that it was is some other virus. I think particularly I struggle with parents who tend to refer to their gastrointestinal problems as the flu. It's a very common thing to say, I was sick with vomiting and diarrhea. I really had the flu badly, when that was not the flu.
Right.
Flu, for the most part, for adults, doesn't have GI symptoms.
Absolutely.
In fact, I think we have a graphic where the CDC has put together columns showing what are typical symptoms of influenza and what are typical symptoms of the cold. As we look at the list, yes, the influenza causes an abrupt illness. You're suddenly sick, whereas the cold, we sort of feel it creeping on, get a feeling in the back of our throat or in our nose that something's not right. There's usually a fever with the classic flu, whereas it's rare with the cold. Body aches are common with the flu, but not so with the cold, whereas fatigue and weakness is almost always the case with the flu, only occasionally occurs with the cold. On the other hand, sneezing's more of an issue with the cold, as is having a stuffy nose and a sore throat. These only occasionally happen with influenza. Chest discomfort and cough is the rule with the flu. We might see a little bit of it with the cold. Headache's very common with the flu and rarely shows up with just a plain old upper respiratory illness or cold.
Absolutely. And if people are having these symptoms and they're not sure what they have, it's okay to call your doctor and have them help you kind of sort through it and determine if you need to be seen, right?
Yes.
Okay.
We need our patients with influenza to have worked out a plan with their clinician as to what would happen. Some of us actually need to go on antiviral therapy in the first 2 days of having influenza. And so we can't just wait out an illness to see which way it is. If we really think it might be the flu, we need to have that conversation, because the antivirals for the flu work best in the first 2 days. These include patients who are less than 12 months of age, patients who are 65 years and older, patients who are on certain medications or certain chronic illnesses. We need a game plan for these patients that are worked out before the flu hits. Pregnant women need to have worked out a plan with contacting their clinician, because if they come down with the flu, they are really at risk for ending up being hospitalized or worse with the flu. And they not only need to get the flu vaccine to prevent it, but need a plan for when do I start those antivirals.
Absolutely. So flu can be serious, and I often struggle with people saying, oh, it's just the flu. It's not a big deal. But how serious can influenza actually be for people that even don't have medical conditions?
Well, it can kill you. And in fact, we lost probably 180 children last year from the flu, the highest number we've ever recorded in the United States who died from the flu. And the overwhelming majority had not got their flu vaccine and did not have one of those underlying conditions. That's a problem. We know the flu is common. We know it can be severe. It can land a person in the hospital. We believe that any year in the United States, 20 to 80,000 of us die from the flu. It's a huge number. It varies from year to year, just as we talked about when the seasons start and stop. We know we have 3 strains that circulate during the year, and some are harder on children and some are harder on adults, but it can be very bad. And in fact, children under the age of 2 are hospitalized at the same rate as adults 65 years and older.
Wow.
That's how hard the flu can be.
That's incredible. it's really scary. So, but there are things we can do.
Yes.
Right.
Yes.
So, what are some of the things that we can do to either prevent or talk a little bit more about some of the treatments?
Job number one is the vaccine.
Okay.
We have been pushing the vaccine as a universal vaccine for every one of us. In fact, within a season, even the children less than 6 months of age will turn 6 months of age during the flu season should get the vaccine. Pregnant women should get the vaccine. You have a significant illness that puts you at higher risk for disease, you should be getting the vaccine. If you have no problem with the flu and you've gone many years without even being diagnosed, you should get the vaccine, if only to protect those people around you who don't do as well with the flu. People have funny feelings about whether they're at risk, but they need to think about those around whom are at risk too. You can, with all your bravado, claim that you're going to stay out of the doctor's office and out of the emergency room and you won't be sick with the flu, but you're going to work every day with the flu symptoms actually is putting your coworkers at risk and their children and their elderly.
Exactly.
And that's not fair. You should be getting the vaccine.
Right. And like you said, a lot of healthy people do get sick and actually die from influenza.
Yes.
So not to spread fear, but it's a real possibility. It's not like an illness that's been completely eradicated. We were talking earlier about polio. So
yeah, we're getting close to polio eradication. It's going to be a lot harder with influenza. Polio actually only affects humans and doesn't go into the soil and doesn't go into animals and like the flu. The flu actually regularly infects swine and regularly infects chickens and other fowl. So we're going to have a harder time eradicating this.
Absolutely.
Frankly, we're not even doing a good job vaccinating. We're at rates of 30-40% when we should really be at higher rates. One of the most beautiful studies I've seen done, a randomized clinical trial involving healthy young adults, 18 to 45 years of age, vaccinating them over 2 seasons or not, and then monitoring their doctor's visits and their ED visits and their sick days away from their employer. And on average, the vaccinated had 1 less day of work lost a year and 1 less doctor visit a year than those who didn't get vaccinated. So even for healthy young adults, they should be getting the flu vaccine.
Fantastic. Let's talk more about the vaccines, and we have lots of great audience questions that are coming in about it. Which strains, you mentioned there's a couple different strains are included in the vaccines.
Yeah.
And then I want to talk a little bit more about which vaccines are safe for which people.
Good questions. First of all, we have 3 strains that are put into the classic trivalent flu vaccine, and more of us are using the quadrivalent that actually have 4 strains. Now, one of the strains in either the trivalent or the quadrivalent, in fact, in every flu vaccine available this year, is against the pandemic version, the H1N1 that hit us in 2009, 2010. We still see every year cases of that. The second strain is another A strain, H3N2, that actually has been hitting us hard in the last few years. It's the one that is causing the most of the outbreaks and most of the hospitalizations and illnesses. And that's in all of the flu vaccines. Then the trivalent has one of the B strains, usually the one predicted to be circulating this season. The quadrivalent has both B strains. Now, Mayo Clinic, as a rule, goes with quadrivalent for those under 65 years of age. We particularly like the quadrivalent because it gives 2 B strain coverages, and B strains are harder on children, so this is a nice vaccine to really protect the children. But the trivalent is a great vaccine, and with the elderly, and as I get closer to this age group, I'm going to stop saying elderly. People 65 years and older really should be getting one of the special vaccines designed just for them, either the high dose or the adjuvanted influenza vaccines, and those are trivalent. The focus there is on the A strains. They have one of the B strains, but it's the A strains that will really do those people in, send them to the doctor's office, keep them home from work, or send them to an emergency room or worse. Now, We also have a flu mist or nasal spray vaccine for those people 2 to 49 years of age, otherwise in good health and not pregnant. This is a live attenuated vaccine that involves 2 squirts, 1 up each nostril. It's quadrivalent. It covers all 4 strains.
Absolutely. So what if a person is immunosuppressed? So say they have cancer or some other illness. Are they able to get the flu vaccine this year?
They are. And we don't wait until they've recovered. We don't wait until you're done with chemotherapy or radiation therapy. As soon as the vaccine's available, we vaccinate. We also hope everyone in your household, and all of your friends and neighbors, and all of the people at work get vaccinated, protect you. We certainly, at Mayo Clinic, take it very seriously, make sure all of our employees get vaccinated to help protect you. And we want everyone around you to protect you so that while you may not respond to the vaccine, you're not even exposed because everyone else is taking care to get vaccinated. Now, we don't vaccinate immunocompromised people with the live attenuated intranasal vaccine, the flu mist, because of theoretical reasons. That is a live vaccine, and while it doesn't grow at body temperature and only grows at room temperature, we just want to be extra careful. The way we are with pregnant women, and we recommend all pregnant women get the injected inactivated vaccine during their pregnancy, mainly to protect themselves rather than protecting their baby to be. And then but with the live, we say, no, let's not give it to those who are immunocompromised. Let's not give it to those who's pregnant, just for theoretical concerns.
Absolutely. So we've had a couple questions on it, so I just want to make it clear. So if you're on immunosuppressive drugs like methotrexate or Humira or cancer drugs, the inactivated injection form is safe for you and recommended.
And recommended.
Okay.
And while it may not work as well as we'd like, you at least get some protection. And that's something else I wanted to stress. People often say, well, I've heard the flu vaccine didn't work very well last year. It only works 50% of the time. So what's the point? Well, I would say 50% is a lot better than 0% protection. And new studies this year showed that people who get the flu vaccine and then end up getting the flu get a lot less sick than the people who didn't get the flu vaccine. So it's not just it keeps the flu virus away, you don't get as sick with it.
Absolutely. What about young kids? So starting at 6 months of age is when we first start the flu vaccine, but we said they need 2 in that first year. Why is that?
The body, for the most part, when you're less than 6 months of age, completely ignores the vaccine. It's not that the vaccine's dangerous. The body just doesn't care that it got it. It doesn't look at it, doesn't form immunity to it. In fact, it takes 2 doses that first time around. And if you wait till the child's 2, 3, 4, 5, all the way up to through age 8, you need 2 vaccines the first time to finally get immune to the flu. So we look very carefully for children under 9 at their flu vaccine record to see, do they need 2 this year or just 1?
Absolutely. We have some questions about safety of the flu vaccine. So people are wondering about things being added to it. One of the questions is about nickel. Is there any nickel that goes into the processing or making of it?
No, there isn't. And frankly, we do take vaccine manufacture very seriously. The vaccines, unlike our other medicines, the medicines we even use to treat the flu or treat complications, are actually tested in far more people than the antibiotics or antivirals. So we actually know going into licensure of the flu vaccine that this is safe through randomized clinical trials. Furthermore, the manufacturers are monitored throughout the manufacturing process. I need to point out, this is not done with homeopathic medicines. This is not done with vitamins or minerals or herbal supplements. Because of our nation's laws, those aren't monitored at all by the FDA. So people who tell me they aren't going to do the flu vaccine because they're worried about safe had better not be taking any probiotics or vitamins or minerals or homeopathic medicines or cold syrups or the antibiotics or the antivirals, because we're talking about far less testing for the licensed drugs. And then for that whole host of herbal supplements and other things sold in drugstores, there's no testing at all.
Right. So this is one of the most tested things that we have in the United States and in the world, right?
Yes.
That we give to people.
And we give it literally to more than 100 million people a year, and we continue to monitor the safety of the people received, because physicians and nurses and nurse practitioners and manufacturers must report side effects, and anyone else can report side effects. So we continue to monitor through the vaccine adverse event reporting system and other programs in place the safety of these vaccines.
Absolutely. Another good question for you. People wonder about if they can get sick from the vaccine. So I often hear this a lot. They say, "Oh, I never get the flu vaccine. The year I got it, I was sick the whole winter." Can you talk about that?
Yes. First of all, you need to know the injected inactivated version cannot revert back to the wild form of flu. It is actually in no condition to be resuscitated, and it never has. The live attenuated flu vaccine, that's the nasal mist, only grows at room temperature, and we've yet in all of its history had a case where it reverted back to the wild form or caused a disseminated infection, even in somebody who's immunocompromised who inadvertently got it. You can't get the flu from the flu vaccine.
Okay.
Moreover, I want to tell you a story, a beautiful randomized clinical trial done at the Minneapolis Veterans Administration Hospital, the VA there, where they recruited vets, 65 years and older, who agreed to be in a study, a very special study. Half of them were randomized to get the flu vaccine one September month, and half were to get salt water that same day. And then they were to keep diaries for 2 weeks afterwards. They didn't know whether they got the salt water or the flu vaccine, but they kept their diary. They wrote down everything. They were quizzed on how sick they were and what they got. And then they all came back 2 weeks later. And the group that got salt water got the flu vaccine. The group that got salt water got the flu vaccine, got salt water. Another 2 weeks. Then they brought them all back and broke the codes, found out who got what, opened up the diaries, and lo and behold, there was a small percent, about 1%, who said they were sick as dogs. They had never been as sick in their entire life. Another 4 or 5% claimed they got a very bad case of the flu. There was 3 or 4% who had bad headaches. And there were people who had muscle pain at the injection site. There were people who had headaches. And lo and behold, it was the same percent whether you got the flu vaccine or salt water for all of those symptoms, except for the muscle soreness at the injection site. It was the only thing associated with the flu vaccine in that age group as compared to the salt water. I think it tells us a story. We human beings look for connections, and we look to blame the thing that we did that was out of ordinary. And so we turn to the last injection and say, it must have been that. Because it was a one-time thing that I remember getting. This must be due to that. When we do randomized controlled trials, keep everyone blinded, and do good real-time comparisons, we find out, it doesn't make you as sick as a dog. It doesn't even make 1% of us sicker than dogs. It doesn't give us the flu. It doesn't give a look-alike illness of the flu. In fact, those are just bad things that happen around the fall to some people, and it would have happened whether you got the flu shot or not.
Right, because there's lots of circulating viruses that happen in the winter months.
Yes.
So,
yes.
Absolutely. So another great audience question. These are fantastic. Please keep sending them in. For someone who got the flu vaccine last year, they want to know, why would they need to continue to get them yearly?
Well, as you recall earlier, I talked about how the flu viruses circulate around the planet and actually mutate and evolve as they meet resistance because they want to infect. So as people get sick with the flu or get vaccinated and protected against the flu, the virus eventually mutates. And soon the next season, we're seeing a new crop of virus. That's why the flu vaccine actually has to be basically reinvented each year to manage the new strains that are going to be circulating. And this year is no different. It is a new vaccine to meet up and match what we predict based on what's circulating around the world.
What about if someone already has the symptoms of flu during the year, but they haven't got their flu shot yet? Is there value in them still getting the vaccine for that year?
That's a great question, because you think, well, I got the flu, was diagnosed in emergency room, they hospitalized me. Why would I need the flu vaccine for the rest of the year? I'll just make a better job of getting it next year. Well, it turns out there's several strains. You might have been infected with the pandemic A strain, or you might have got that H3N2 or one of the B strains. In fact, the H3N2 and the H1N1 might also recombine this season and form a new strain. So it pays to get vaccinated even if you've had a diagnosed case of the flu, because there's other strains you might meet in the months to come.
Those are all, thank you for sharing all that about the flu vaccines. That was wonderful. We talked, flu vaccines is number one prevention, but what are some other things that we can do to try and prevent the spread of influenza?
I think we have a table that we can show. First of all, get vaccinated.
Yeah.
But talk up the flu vaccine. Make sure everyone in your household has gotten vaccinated. Encourage your fellow students and coworkers to get vaccinated. This is an important thing. We don't go to the doctor that often, and most of us won't have a reason to visit the doctor this fall, thank goodness. But for many of us, if we don't make a special point in getting the vaccine, either at the pharmacy or at our place where we work or at our doctor's office, it's not going to happen. So you need to push it and promote it. And of course, eating healthy, getting enough rest, and exercising regularly, both gives you the stamina to resist infection and then to deal with infection when you get it. I can't stress that enough. Washing your hands will help prevent the spread of that virus and other viruses. Your hands are the most likely to transmit the flu virus. If you can't get to soap and water, use an alcohol-based hand sanitizer with at least 60% alcohol. Cover your mouth and nose with a tissue when you cough and sneeze, or cough or sneeze into your elbow. You know, when you just cough into the air or turn your head to cough on the neighbors behind you instead of the neighbors in front of you, you're not doing anybody a favor. Get control of your secretions. Stay at home from work, school, and errands when you're sick. I can't stress this enough. Right. I know we live in a day and age when we think we have to be at work or the whole place will fall apart, or we have to be at school or we'll never catch up. It turns out you're staying at home. It's good for you, and it's probably good for your work environment and for the coworkers, and you'll discover, oh, they can actually learn how to get by without me. And the schoolwork, you can catch up, and you'll do better catching up if you get a few good nights' rest and you recover from your illness. Absolutely. You should avoid close contacts with others when you're sick. You shouldn't be showing up at work. You shouldn't be showing up at social events. And you shouldn't be going to the hospital or nursing home with your illness. You're making a big mistake. You're really putting people at risk who may not respond to the vaccine and may do very poorly.
Absolutely. Those are fantastic tips. We have one more audience question I want to get to before we end our show for today. And this goes back to the flu vaccine. Lots of great questions about it. You mentioned that, we have 4 different viruses that are strains of the virus, that are included in our immunizations here in the United States. Are those same strains that are included here going to be protective if you're traveling throughout the world during this influenza season?
Yes, this is a great travel vaccine. And, I know that my colleagues in travel medicine at Mayo Clinic, the first thing they do is make sure you got the vaccines that you're due for just staying here in the country. And the flu vaccine is really important when you travel, because you might find yourself in close quarters on an airplane or on a ship or at a restaurant or at some other venue where you can't really escape the person who's coughing or sneezing next to you, and it's ruining your trip, and it's going to be a disaster for you. So consider the flu vaccine one of your most important travel vaccines.
Absolutely. Well, this has been fantastic. Do you have any resources or anything else you'd recommend to families?
I'm going to talk about 2 links that I want everyone to consider writing down right now. cdc.gov/vaccines. That's not vaccine, that's not immunization. It's cdc.gov/vaccines, plural. That will get you to a website where if you're a parent or a healthcare worker or a member of the general public, you want to learn more about the vaccines, that's a great landing place, cdc.gov/vaccines. A second one that is really very friendly both to lay people and people in healthcare is immunize.org. IMMUNIZE.org. Immunization Action Coalition has put together so much wonderful information, including stories of people who regretted their decision not to vaccinate, great descriptions of the illness, great photographs of some of the vaccine preventable illnesses, and great resources for parents who have questions about vaccines and side effects, vaccines and their ingredients. It's a great go-to place, immunize.org.
Yeah, I have it on my favorites list that I go to frequently. It's wonderful. I agree with both of those resources. Thank you for joining us today, Dr. Jacobson. It was wonderful.
Oh, you're welcome, and thank you for having me.
Absolutely. You can join us for the next Ask the Mayo Mom, which will be on November 1st at 11 a.m. Central Standard Time. We will be having Dr. Amir Orandi, who's a pediatric rheumatologist, and we'll be discussing juvenile idiopathic arthritis. And it's going to be a great discussion. Thank you, everyone who watched, and have a great day.